The Akita's powerful presence often masks a hidden vulnerability to specific health conditions that can shorten their lives. Understanding these risks is the first step toward proactive care. Akitas are a robust breed, but like all large dogs, they are susceptible to certain life-threatening issues. One of the most significant concerns for Akita owners is cancer. Several types of cancer are observed more frequently in this breed. Lymphoma, a cancer of the lymphatic system, is a primary threat. It often presents with subtle signs like swollen lymph nodes under the jaw, in front of the shoulders, or behind the knees. An Akita with lymphoma may show a lack of appetite, weight loss, or general lethargy. Early detection through regular veterinary checkups is critical. Osteosarcoma, an aggressive bone cancer, is another major concern. It typically affects the limbs, causing a noticeable limp or swelling. The pain can be severe, and the dog may become reluctant to put weight on the affected leg. Because of its aggressive nature, osteosarcoma requires immediate veterinary intervention. Finally, hemangiosarcoma, a cancer of the blood vessels, is a silent killer. It often develops on the spleen, liver, or heart, and may show no symptoms until it ruptures, causing sudden internal bleeding, collapse, and shock. This condition is an emergency, and unfortunately, the prognosis is often poor even with surgery. Regular wellness exams, including blood work and imaging like ultrasounds as the dog ages, can sometimes help catch these cancers before they become advanced. Bloat, or gastric dilatation valvulus, is another severe and rapidly fatal condition in Akitas. Their deep-chested build makes them anatomically predisposed to it. Bloat occurs when the stomach fills with gas and then twists on itself, cutting off blood supply to the stomach and other organs. The signs are sudden and dramatic: a swollen, hard abdomen, unproductive retching or attempts to vomit, excessive drooling, and signs of extreme pain like restlessness or pacing. An Akita experiencing bloat may whine, groan, or stand with a hunched back posture. This is a life-or-death emergency that requires immediate surgery. Without it, a dog can die within hours. To reduce the risk, owners can feed their Akita smaller, more frequent meals instead of one large one. Using a slow feeder bowl can prevent them from gulping air along with their food. It is also crucial to avoid vigorous exercise for at least an hour before and after meals. Some owners opt for a preventative surgery called a gastropexy, which tacks the stomach to the abdominal wall to prevent it from twisting. This is often done at the same time as a spay or neuter procedure and can be a life-saving measure for a high-risk breed like the Akita. Heart disease is a significant cause of mortality in Akitas. While various cardiac conditions can occur, certain issues are more prevalent. Dilated cardiomyopathy, or DCM, is a disease of the heart muscle that results in an enlarged heart. As the heart weakens, it cannot pump blood effectively, leading to congestive heart failure. Symptoms can be subtle at first, including reduced exercise tolerance, coughing, or difficulty breathing. As the condition progresses, the dog may experience fainting spells, a swollen abdomen due to fluid buildup, and severe respiratory distress. While there is no cure for DCM, medications can help manage the symptoms and improve the dog's quality of life for a time. Another concern is aortic stenosis, a congenital condition where there is a narrowing at the aortic valve, obstructing blood flow from the heart to the rest of the body. Mild cases may cause no symptoms, but severe cases can lead to fainting, fatigue, and sudden death, especially during exercise. Regular veterinary checkups that include listening to the heart for murmurs are essential for early detection of these cardiac problems. Autoimmune diseases are unfortunately common in the Akita breed. In these conditions, the dog's own immune system mistakenly attacks its body's tissues. One of the most well-known in Akitas is sebaceous adenitis. This disease attacks the sebaceous glands in the skin, which are responsible for producing oils that keep the skin and coat healthy. Early signs include a dry, brittle coat, excessive dandruff or scaling, and patchy hair loss, often starting on the head and neck. The skin can become thickened and develop a musty odor. While not directly fatal, it can lead to severe secondary skin infections that, if left untreated, can compromise the dog's overall health and quality of life. Another serious autoimmune condition is pemphigosis foliaceus. This disease causes the immune system to attack the connections between skin cells, leading to blisters, pustules, and crusting sores, particularly on the nose, ears, and paw pads. It can be painful and requires lifelong management with immunosuppressive drugs. Vokoyanagi-Harada-like syndrome, or VKH, is a severe disorder that attacks both the eyes and the skin pigment. It can cause a sudden and painful inflammation of the eyes, leading to blindness, and is often accompanied by the whitening of the coat, nose, and lips. These autoimmune disorders require a definitive diagnosis and a dedicated, long-term treatment plan from a veterinarian. Musculoskeletal and neurological issues can also lead to a decline in an Akita's quality of life, sometimes resulting in euthanasia. Hip and elbow dysplasia are developmental disorders where the joints do not form correctly, leading to instability, pain, and eventually debilitating arthritis. An Akita with dysplasia may have difficulty rising, be reluctant to climb stairs, or show a bunny-hopping gait. While not directly fatal, the chronic pain and loss of mobility can become so severe that quality of life is severely impacted. Management includes weight control, joint supplements, pain medication, and in some cases, surgery. Degenerative myelopathy is a progressive disease of the spinal cord in older dogs. It is similar to ALS in humans. The disease starts with weakness and loss of coordination in the hind limbs, causing the dog to drag its paws. Over time, the weakness progresses to paralysis. While the condition itself is not painful, the loss of mobility and eventual incontinence often lead to a decision for humane euthanasia when the dog can no longer support its own weight or maintain its hygiene. Responsible breeding practices that include screening for these conditions are vital to reducing their incidence in the breed. Finally, kidney disease or renal failure is another condition that can affect Akitas, particularly as they age. The kidneys are responsible for filtering waste products from the blood. When they begin to fail, these toxins build up in the body, leading to a condition called uremia. Early signs of kidney disease are often subtle and can be missed. They include increased thirst and urination as the kidneys lose their ability to concentrate urine. As the disease progresses, symptoms become more severe and may include loss of appetite, weight loss, vomiting, lethargy, and a chemical-like odor on the breath. Chronic kidney disease is a progressive condition with no cure. However, its progression can often be slowed with proper management. This typically involves a special prescription diet that is low in protein and phosphorus to reduce the workload on the kidneys. Fluid therapy may also be necessary to help flush toxins and prevent dehydration. While management can extend a dog's life and improve its comfort, the disease will eventually progress to end-stage renal failure. Early detection through regular senior wellness screenings, which include blood and urine tests, gives an owner the best chance to intervene early and manage the condition effectively for as long as possible.